Welcome, everyone. Fantastic to see so many of you attending our seminar. It's a Department of Global Health and Social Medicine and Centre for Society and Mental Health jointly co-hosted seminar that I'm pleased to invite you to. Fantastic that you could all come. My name is Hannah Kienzler. I'm the co-director of the ESRC Centre for Society and Mental Health. It is my huge pleasure to welcome our new colleague, Ben Baumberg Geiger, who is going to present to us about towards a mental health promoting welfare system, what we know and what we don't. So it's just a huge privilege to have you here to talk about your work. And I would just like to give a brief introduction about you, Ben, and then hand the floor over to you. So Ben will join our department, the Department of Global Health and Social Medicine, as well as the Centre for Society and Mental Health at King's College London in August. So it's such a great opportunity to hear you speak now about your work and for us to just hear about what you have been up to over the past, I suppose, months and years. You are going to co-lead, so Ben is going to co-lead the program on work and welfare reform in the Centre together with Professor Karen Glaser. His mixed methods research largely focuses on mental health, disability, benefits and work in high-income countries. He spent much of the past decade reviewing international evidence to propose a better disability assessment in the UK, which culminated in a report and published in 2018, A Better WCA is Possible. He currently leads the Welfare at a Social Distance Project 2020-2022, which investigates the UK benefit system during the COVID-19 pandemic. So this is a project funded by the ESRC as part of UKRI's rapid response to COVID-19. So Ben's presentation today is extremely timely and pertinent. We will have the presentation about 40 minutes, and then there will be quite a bit of time for a Q&A, so some question time. You can leave your questions in the chat, or we will also give you the opportunity to simply unmute yourself and ask your question directly to Ben. I'm going to monitor this. The presentation is going to be recorded. So if you prefer to remain anonymous, please feel free to just change your name on Zoom and keep your camera off. But otherwise, yes, it is going to be recorded. So without much further ado, I'm handing the floor over to Ben. So thank you again very much for sharing your work with us.
Brilliant, thanks so much, Hannah, and the CSMH team. I will come on to be talking about the Welfare at Social Distance Project on the one hand, and joining the Centre shortly in a second. But I just want to start by sort of setting the scene a little bit here and sort of inviting you to be part of, in a way, a discussion about how we move towards a mental health promoting welfare system. So the first thing to say is that when we think about welfare, I'm using welfare as synonymous with social security, benefit system, social protection, and so on. When we think about welfare, we need to think about disability. It's one of the things that often people don't do when they're thinking about the benefit system, but it is fundamental to the operation of the benefit system in Britain and similar benefit systems across high-income countries. So this is just a graph showing spending since 1980 on the benefit system. This is spending as a share of GDP, so it sort of fluctuates around 4 or 5% of GDP, which is a very sizable amount of money. But what you can see is, firstly, that even in 1980, incapacity benefits, so these are sort of out of work disability related benefits, were still amounting to about 1% of GDP. So they were still a reasonably large level then. But that has substantially increased since then, partly because of rises in spending on incapacity benefits, but also the introduction of disability benefits to pay for the extra costs of disability, whether people are in work or out of work. So you can see that sort of rising over time since their sort of major introduction in the 1990s. And now I'm not going to show you a graph on this. These have increasingly been about mental health. So if you want to understand, who is receiving benefits and how much people are receiving, this is increasingly around health and disability, and within that, particularly around mental health. At the same time, when you think about mental health, I think it's essential to think about welfare for two reasons. One of them is that there are a large number of studies now showing how welfare contributes to mental health problems in the UK. I'll mention some of them in the presentation, but just to mention one particularly influential one, Ben Barr and colleagues a few years ago showed the rollout of the work capability assessment, which is the disability assessment for out of work benefits, which I'll come back to, was associated with between 400,000 and 1 million extra antidepressant prescriptions and 200 to 1,000 suicides. And this is a reasonably robust study. So there is good evidence that welfare is a determinant of mental health. But more than that, there are a lot of people with mental health problems claiming benefits. And whether the system treats them fairly or not, or whether they get the amount of money they should do or not, are issues of social justice, in some ways irrespective of whether they're making people's mental health worse or not. So I think sort of from these two angles, when you think about welfare, you must think about mental health. And when you think about mental health, you must be thinking about welfare. So from that perspective, what I want to mostly talk about today, in the face of lots we do know about the link between mental health and welfare, is to sort of think about a few gaps and where we might need to go next to do the knowledge base for a mental health promoting welfare system. I should say, obviously, that there's a lot to do with getting to a mental health promoting welfare system that depends on the politics of it rather than the knowledge base. And we may come back to that in the discussion a bit. But I want to really focus here on the things that we don't know that we really should do. And I'm going to divide these into three bits. Firstly, talking about income. Secondly, talking about conditionality. And then thirdly, I guess, talking about everything else, which I'm going to use the term claimant experiences to sort of summarize. And then at the end, I'm just going to talk about a few ways in which we could move to a different, more mental health promoting welfare system and the questions we have about which of those options might work best. Now, I'm just going to pause for a second to say, this is the start of what will hopefully be a longer, deeper conversation with many of you about what we need to do and how we need to go about doing it, which obviously also involves working with people with lived experience of mental health problems and lived experience of welfare. I'm at the moment co-leading with Lisa Scullion a project called Welfare at Social Distance, which, despite originally being around the benefit system during COVID-19, is sort of still going. We have a survey in the field at the moment of about 6,500 benefit claimants, which includes a substantial component of questions on mental health. And so there'll be a report that comes out as part of the Welfare at Social Distance project, as well as the Centre later in the year. But also I'm really excited about moving to King's and the Centre and the department to co-lead the strand on work and welfare reform. And as part of that, we will really be thinking about what are the most important things for us to be working on in collaboration and in conversation with other people about work and welfare reform and mental health in the UK. So hopefully what I will say here will be interesting and thought-provoking, but also there may be things that you think I've got a bit wrong or things that I haven't really talked about that you think we should be really working on as a team. So please do say these things in the discussion at the end, but also drop me or any other member of the team an email and we'll be really glad to chat about it. So this is a sort of a starting point of my initial thoughts just prior to taking the job, but there will be a lot further thinking about this that goes from this point. So the first bit that I want to talk about in detail is around benefits, income and mental health. I guess because in the current climate with the cost of living crisis, it seems impossible to start by talking about anything else. And I'm not going to spend ages talking about it because we know this very clearly and it is incredibly important, but there is not a knowledge gap here. We know that benefits were already, prior to all of the issues around cost of living at the moment, below what people in Britain could reasonably consider a minimum income, and that this causes problems for mental health. What is worth quickly drawing attention to is that the headline level of benefits are not actually what a lot of people claiming benefits receive. Partly because if people are moving to universal credit, they face a 5-week wait for benefits, as has been much commented on, partly because of issues around the benefits cap and the bedroom tax, which are kind of, you get your entitlement to benefits calculated, but then a bit of that is cut off because of limits that have been put in for one reason or another, that are quite contested. And then also, nearly half of universal credit claimants have money taken off the payments that DWP give them, often repaying advances. Well, they had that 5-week wait for their initial payment, but also historic tax credit debts are quite common, and a few other things as well. So the DWP is often giving people less money than the sort of headline rates might have you believe, even though those headline rates are not really a reasonable minimum income. On top of that, when we were last doing a survey for the Welfare at Social Distance project, we found that over half of claimants had repaid a debt in the preceding month. Many of them had repaid more than £100 in that month. So even taking into account, they get a certain amount of DWP, the actual amount that people have to live on is even lower still. And we know that there are strong links of this directly to mental health. There's a few studies linked there. Some of them are evaluations of particular things like the benefits cap. Others are more general reviews about the link between income or benefits income and mental health. We will circulate the slides afterwards. So you will be able to click on the hyperlinks to go to the papers rather than worrying about a bibliography now. Now, as well as this kind of general issue about the amount of money that people receive, that was insufficient before and it's going to be increasingly insufficient as time goes on, I guess, depending a little bit on what happens, whether the payments happening in the autumn are one-off or not. But there are extra payments that go to some people with mental health problems in the benefit system. And really, you cannot understand the operation of the benefit system without understanding this. As a Resolution Foundation report in January this year made clear, one of the ways in which the benefit system has been developing over the last few decades is we've been paying less and less money in, say, the headline rate of unemployment benefit, and is now one of the lowest headline rates in any high-income country in the world. But what we've done increasingly is put more money towards extra costs. So we give more money on housing, partly because our housing market is so dysfunctional in the UK. We give more money to people with kids than before, and we give more money around disability. None of which is enough to make us a generous welfare system overall, but they move us from near the bottom up a little bit closer towards the middle. And this is the way that our benefit system now operates. So the maximum amount that someone could get for mental health related reasons from a combination of universal credit and PIP, the extra cost benefit, is about £1,000 a month, which is much higher than the £300 to £500 a month that people would get in their standard UC allowance, depending on whether they were single or in a couple. These are the rates for over 25s, and the 25s get lower. The amounts are all very complicated, but the overall picture of these very large health and disability related payments is clear. Now, is this sufficient to mean that people with mental health problems have a better standard of living than other people? No. So again, looking last year, people with disabilities in general had higher levels of food insecurity than non-disabled people that were otherwise similar. It was only slightly higher if they were getting the extra money from universal credit and PIP. If they weren't getting those extra supplements, their risk of food insecurity was much higher. And this is obviously to do with a bunch of things that I'm sure this audience know well around the extra costs that people with mental health problems and other disabilities face in achieving a comparable standard of living, and also the fact that people with mental health problems in particular are likely to be out of work for long periods of time. And the longer you're living on a low benefits income, the harder it is to deal with. But so the picture I want you to have got so far in terms of benefits income is the fact that the general level of income that people get is too low. There are additional payments that go to people with mental health problems, which sort of partly offset the additional costs that people face, but are not enough to really dent the risk of severe poverty and food insecurity for them. But one of the things that is the biggest problem here, which I spent a lot of time working on, is the way in which we decide which people with mental health problems receive this extra financial support or not. And there's two flaws with the way in which we do this at the moment in the UK. The first flaw I've described in the past as assessing genuineness, but a lot of the discussion and the literature would sort of say that this is around trying to root out so-called malingering. So there is a feeling from the people that are doing these assessments, some of whom I've spoken to, that part of their job is to try and weed out people that are not telling the truth about how their mental health problem affects their daily lives. And so they have a certain amount of medical records, sometimes from people, although that system doesn't work very well. There's a form that people write, quite often with help from other people around them. And then there's often a kind of a single short meeting that used to happen always face-to-face, but now sometimes happens by phone, where these assessors are trying to judge if someone is telling the truth or actually describing the impact of their mental health problem. And this is, to put simply, a deeply, deeply flawed process. So there are many reports, for example, just where assessors saying, oh, somebody didn't seem like they were depressed or anxious on the basis of a short conversation over the phone, without really there being any evidence base about the extent to which people can really assess people's mental health very well from this sort of interaction. So one of the problems around these assessments is around things to do with genuineness, and there's just a gap in our knowledge. We don't really know what is happening in work capability assessments or PIP assessments. We don't know exactly why tribunals, so if people are unhappy with the decision, they can go through appeals and after quite a painful process, end up in a tribunal. And the tribunals, more often than not, throw out the DWP's judgment. And it seems that people are much happier with the way in which tribunals are assessing the way in which people's mental health problems are affecting their day-to-day lives. But we don't really know what the tribunals are doing differently, apart from a few very high-level bits of research on that. And we also don't really know what should happen. What is a reasonable process here? And in the 2018 think tank report, I sort of set out a few things I think we should do here. But again, we need a much better evidence base. Personally speaking, I think a sensible approach would be you have to trust what people are saying nearly all of the time. And if you are going to overrule people's descriptions of their own lives, that needs to be really transparent and that needs to be based on something really, really clear and defensible. And none of those things the way that this process is happening at the moment. The other thing that goes wrong in these assessments, I should say, I think these assessments are pretty disastrous by international standards. They're always difficult and contentious, but the UK has really managed to do something with its assessments that I haven't seen any other country manage. So aside from these issues around the assessment of genuineness, there is an issue around the assessment of work capacity. So once you said, right, somebody's mental health problems affect their lives in the following ways, how do we link that to people's work capacity, which is what the work capability assessment is meant to assess? This is where the universal credit bit and the ESA bit, which is around work capacity, differs from the PIP assessment, which is around the extra costs people face. Although the criticism that I say you can make equally, similar sorts of criticisms of the PIP assessment. So the problem with the way that the WCA assesses work capacity is that it has a series of functional descriptors, which it sort of separates into physical and mental cognitive in a way that the courts have found is not particularly defensible. And there's just no real evidence linking these descriptors to the actual demands of the workplace. So we can contrast this with the Dutch system, for example, where they have a live database of 8,000 actually observed jobs, where they assess the functional demands of those jobs, and they have a team of 30 or 40 people whose only job it is to go into workplaces and look at the functional demands of work in a variety of different ways, so that this can underpin a more robust and evidence-based assessment. But we don't have anything like that in the UK, and this is again a massive evidence gap, notwithstanding that it's not necessarily the case that you would want to have the Dutch system. It might be something a bit more far-reaching, as we will come to later on. So this is the issue around benefits income. So firstly, the amount that people in general get on benefits is too little. There is kind of additional payments for mental health problems or other disabilities in some cases, but the way in which we decide which people get money is pretty terrible, and has been known to be pretty terrible from a wide variety of people, some of whom I know are in the audience at the moment. Now, I talk about this much more in a Demos report from 2018, which you can find there, and also in the accompanying paper. But it's worth saying I'm going to come back to disability assessments below, because disability assessments are not only important because of who gets how much money, they also have other consequences for people's experiences of the benefit system, as we will come back to. So that's the first thing I wanted to talk about, just around income and mental health and the benefit system. The next major thing that I think, there's been an enormous amount of work on, an enormous amount of discussion around, is to do with conditionality and mental health. So the claim from many policymakers, not just in the UK, and some think tanks and other people associated with the system, is that conditionality is necessary to help get people back to work, which in turn is important for people's mental health. So for those of you who don't spend their lives only looking at issues to do with the benefit system, by conditionality, I mean requiring people to do things in return for their benefits. And if they don't do those things, then their benefits might be partially or completely cut. So often people think about conditionality as the threat and the sanction as actually someone's money being removed. And those two things might have slightly different effects and different evaluations look at them. But the narrative around these things is often the same, that one of the problems is that there are too many people not trying hard enough to get back to work. One version of this account is that people are lazy. That's the kind of harsh Charles Murray approach. Another sort of softer version is more that people have lost confidence in their ability to get back to work. And so what they need is a bit of a nudge and a bit of support to help get them back to work. And that this is the reason for going towards conditionality. But whichever of those versions you do, you see lots of people calling for more conditionality. This is a report from the OECD from a few years ago, who explicitly say helping job seekers with mental health conditions should be achieved by avoiding, as far as possible, exemptions from job search and participation requirements. In other words, the way that good benefit systems should be working is by requiring people to do things and taking their benefits away if they don't. Now, there's a lot of economists, particularly economists, evidence using experimental or quasi-experimental studies to have a look at the effects of these things. This is a reasonably influential, clear summary by Duncan McVicker, which was updated quite recently. As Duncan McVicker puts it, evidence consistently shows that job search monitoring and benefit sanctions reduce the duration of unemployment and increase the rate of job entry, making them potentially attractive policy options. So there are a lot of studies showing this. It is really important to add to that, as Duncan McVicker points out. On the other hand, there is some evidence that such measures can drive people out of the labour force and may reduce the quality of job matches. In other words, force people to take any job that there is to hand rather than finding a job that they would be best suited to and can contribute the most through. So this is sort of the case for conditionality. But there has been a really strong counter-argument around, there's a strong counter-argument in general around things to do with conditionality, but particularly around people with mental health problems. So there's an enormous qualitative study called the Welfare Conditionality Project, which spoke to hundreds of claimants multiple times. So it's bigger than some quantitative studies. And a subset of those people had mental health problems. And a specific report of theirs on a paper of theirs on mental health, concludes that welfare conditionality is largely ineffective in moving people with mental health impairments into or closer to paid work. Indeed, in many cases, it triggers negative health outcomes that make future employment less likely. And those claims from the qualitative evidence are also borne out by what it has to be said is a relatively small number of quantitative studies that look at the effect of conditionality on people with disabilities of one form or another, rather than non-disabled job seekers, which is what most of the kind of economist evidence base looks at. So there's one really nice study in the UK done by the National Audit Office, which I can go into the methodology of discussions. There's also a review paper of mine that summarises it. You'll see the link in a second. But without going into the methods, it shows very nicely using the same method that conditionality has one effect on non-disabled people, but a much more counterproductive effect on disabled people. It actively pushes people away from the labour market in the UK. And there's a few international studies on this as well, showing, for example, that just one compulsory meeting for sick listed people had no effect on disabled people moving into employment. And in fact, a more intensive intervention in Denmark that was very rigorously evaluated and involved weekly meetings and lots of rehabilitation support pushed people away from the labour market again, as the UK study found. So there's a review that I did a few years ago there, and there's a link to a kind of updated version of a Norwegian study that I talk about in the paper there. So, how do we reconcile this sort of strong claims from economists and people like the OECD and many policymakers with what we actually find from the evidence that focuses specifically on people with mental health problems or other disabilities? Well, one possible conclusion is that there are problems with that initial evidence base, and there are various debates we can get into about that. I think probably the more clear thing about that is that there's just going to be a lot of variation in how different people respond to conditionality. When you have people with mental health problems in particular, implementing conditionality is incredibly difficult, and you run a high risk that you are going to require people to do things that they are not capable of doing, which is clearly going to be counterproductive as well as unfair. The other side of it is that people with mental health problems have different barriers to work than other job seekers might do. Paul Gregg, a UK economist and social policy academic who wrote a big report on personalised conditionality in the late New Labour years, in the 2000s, later changed his mind about conditionality for disabled people. And the phrase that he used was that what happens is people are likely to hunker down. They're worried about losing their benefits. They're worried about being required to do something that they can't do. So they're not going to take a risk and instead just stick with what they have in the moment. And this is just the opposite of what you want people with mental health problems to be feeling in terms of moving towards work, where, my way of expressing it is you want a space for safe experimentation. People do not know how it's going to go in a particular job. And rather than pretending that we can assess this clearly in advance, we just want to help people try it, knowing that if it doesn't work out, they're going to be supported and they can just take the next step, which is one of the ways of describing what individual placement support does. So this is sort of the first part of the conditionality story. So the sort of claim that it works, and then actually a lot of people saying that it really is not going to work for people with mental health problems. But that's not actually what I think the major gap in our knowledge is. The major gap in our knowledge is around implementation. Because even if we accept that conditionality is a bad idea for many, most, all people with mental health problems, we need to find a way of implementing this in a benefit system. And nearly all benefit systems, pretty much all benefit systems in high-income countries have quite a large amount of conditionality at a variable extent for unemployed people. So unemployed people will be required to look for work or take work, otherwise they will have their benefits cut a little bit in most countries. So if you're going to have a system with some conditionality, but not conditionality for everyone, then you need a process by which you can make that happen. And we know really little about how to make that process work. So we need to be able to separate out people that should be subject to conditionality versus those who shouldn't, in a kind of a general sense. So this, in the case of mental health problems, people with severe mental health problems there shouldn't be any chance of conditionality. But how does that system work of separating those people out? Then for people that aren't completely taken out of the system, you need to personalise conditionality to people with mental health problems, because there will be lots of people with mild and moderate mental health problems who probably aren't separated out of the system per se. And you also need to think about how to provide employment support and rehabilitation within this. So I just want to talk briefly about all of those two things and the fact that the UK is currently doing all of those things badly, and we really don't understand very much about it. So firstly, how do we decide who to exempt from the system demands completely? And now I'm not just talking about conditionality, but also the requirement just to sort of be in touch with the DWP and just to sort of, do what is required in terms of keeping up with your online journal and universal credit, for example. Now, one way of doing this is to go back to the work capability assessment that I talked about before. But there's two problems with this. One, the work capability assessment is a disaster, as I've already explained. But also, it isn't the work capability assessment, to the extent it is trying to do anything, is trying to assess work capability, and it doesn't do it very well. But it's not really trying to assess if people can cope with the demands of the system or not. So it's just not, for two reasons, it's just not the right way of going about doing it. There are processes in place in DWP to deal with vulnerable claimants, or safeguarding, are the two terms that are often used. But there has been a lot of controversy about whether these work adequately or not. A lot of this is centred on the case of Errol Graham. It's an awful case. Somebody died, someone with severe mental health problems who died in their own home after their benefits were stopped, after the DWP hadn't made contact, and then the family, with the support of a solicitor's firm, took this judicial review about whether the DWP had fulfilled their responsibilities or not, and the DWP won on that case. But there has been a lot of discussion about these sort of safeguarding policies. But from the perspective of people like me, and I guess many of you, who are interested in trying to see what is going on and how well it works, it's just a black box with very little research on what is going on. And it is just a really unknown thing about how that policy actually works in practice. A kind of a parallel problem is around personalising conditionality. So we know that there's lots of reports of unfair conditionality, of work coaches requiring people to do things that they're not required to do. We know that there's risks here. I've done other bits of research that shows that the general public, at least, are more likely to recommend sanctions for sort of some working class claimants than other claimants. There's massive discrepancies where young people are much more likely to be sanctioned. We know there's wider ways in which this could feed into judgments of health that relates to ethnicity. So there's lots of possibilities of injustice here. I do want to stress, though, that, again, our knowledge of even just what conditionality is happening at the moment is very limited. As far as I can tell at the moment, people are being required to turn up to meetings, and people are being sanctioned at reasonably high levels again for not turning up to meetings. But actually, there is almost no sanctioning or even threats of sanctioning happening around, once people have turned up to a meeting, what happens there. And this is not necessarily the picture that you get from the existing academic research on this. Hard to tell if that's partly because things are just a bit different now, post-COVID, than they were pre-COVID. But again, we need to know what is happening on the ground, what actually is happening in those interactions between work coaches and claimants with mental health problems. How are claimants communicating their mental health problems, if they feel comfortable doing so at all? How are work coaches interpreting this? Is it an issue that somehow the interactions don't let people describe their situation, or that work coaches are not doing a good job of responding to it? Or is it that they understand what's going on, but are still requiring people to do things that are unreasonable? Or is it that actually, once they suggest something, there is no safe space for someone to say, I don't think that's actually going to work, and here's why. So we just don't know where the system is going wrong, to what extent, and there's a huge evidence gap there. Finally, and I'm just going to go over this very quickly so I can move over to some other things, that the way in which we do conditionality in the UK, particularly for disabled people, is not how other countries do conditionality for disabled people. So we have what I've called in a paper a few years ago a compliance-based system. We don't necessarily do very good rehabilitation, and when we do rehabilitation, it's not very clearly related to the sanctioning process, and our assessment process is pretty poor. But you can have systems where there's a lot of conditionality, but it is very strongly linked to actually pretty good processes of assessment and rehabilitation. And there is just something different about being required to jump through a hoop that seems a bit pointless versus being required to do something that actually seems quite tailored to your situation and might actually be useful. And there's even other countries that sort of on paper have conditionality, but they don't actually follow through with it. So you might sort of say that they're a conditional system, but basically nobody is ever sanctioned, sometimes with a strong link to rehabilitation or sometimes not. So just there's a lot of complexity to things around benefits conditionality, and just the way it can be implemented and our need to actually understand things at a bit more micro level, I think is really important. Just in the last few minutes, don't worry, I'm most of the way through talking about things. I just want to flag a few other things as kind of provocations that I think maybe are important to think about. So there are numerous testimonies from claimants about the ways in which their mental health are affected by the system in ways that aren't about money and aren't about conditionality, which I sort of call all of these other things claimant experiences. So this is someone describing their situation in a report from Mind a couple of years ago. I'll let you sort of read the quote. The thing I'll just pick out is, I literally lived in fear of the letter arriving. It's such a common thing you hear from people describing how they feel about it. And these sort of testimonies are not uncommon, sadly. Now, there's lots of different ways in which we can think about, what aspects of experiences might be problems for mental health or injustices in their own rights. Some of these are around anxiety and just people's worries, particularly around the work capability assessment, their fear of the brown envelope, the being summoned to something that can have effects on their lives that they have little understanding of and little trust in. There's lots of issues around stigma, and that includes disbelief of mental health problems within the system. There's the fact that the bureaucracy can be complex, frustrating, and unfair, and that can obviously be harder for people with mental health problems. And there again is that sort of distrust leading to hunkering down that I talked about before. And these are just a few of the many, many different places that you can read more about this. Now, I think it's really important to try and create more of a theoretical account of claimant experiences here. I think there's a lot of sort of practical studies, particularly by people at think tanks, policy institutes, or kind of qualitative interview-based research looking at claimant experiences. But it's hard necessarily to get an overall picture of what's going on. So I'm not going to go into this in any detail, but just to say, I think trying to get a picture of all of the different things that be going into this are really important. But maybe more than this, we know a lot about these claimant experiences from all of these accounts and qualitative research, but there's still loads we don't know about them. There's no theoretical framework about which aspects of experience are the ones that matter. So different studies talk about these experiences in completely different ways. There's almost no quantitative evidence in this field. And to the extent there is, it's on benefit stigma. And there's no real evidence of the effects of these experiences in a way that could really show to policymakers why these are really important for welfare system demands. There's some great recommendations, as we'll come to, but they're basically based on common sense rather than a lot of empirical evidence about how you create a mental health promoting welfare system. And in particular, there are no studies about how it feels to claim welfare and have mental health problems in different countries. In fact, there's not really any studies about how it feels to claim welfare in different countries at all, which makes it harder to understand those kind of really macro level, system level causes of claimant experiences. So I'm not going to spend any time on the next slide. I'm going to come to some conclusions in just a moment. I have packed a lot in, partly because we're trying to think about what it is that we need to know about. So we need to talk about all of the research that's been done, as well as the gaps there. But I just wanted to very, very quickly mention a few things that I haven't talked about, but I know are important and you might want to come back to. So a first one is the benefit system is often represented as being between the claimant and the state, but actually loads of people, particularly people with mental health problems, receive support, often from friends and family, often from third sector organisations. And there are problems in the way that universal credit works in terms of allowing that to happen smoothly. There's issues to do with take-up, so I've mostly talked about the experiences of claimants rather than people who didn't claim, but I did some research last year that showed that even in the midst of COVID, where politicians and employers were telling people to claim, probably about 500,000 people didn't claim, and there's going to be some complex relationships to mental health there. There's lots of discussions about ways of linking welfare advice to healthcare and ways in which that can be good or ways in which that can be coercive. And there's lots of stuff about public attitudes, what that means for the politics of it, and what that means for people's experiences of going through the system. So we can come back to some of those in discussion. But what I'm just going to come back to in my last 3 minutes is a few thoughts about how we might move towards mental health promoting welfare in the light of everything I've talked about. So one option is we sort of say we have something pretty much like the current system, but we just make it better. This, we don't need to go through any detail, but this is from an excellent report by Nikki Bond, who may or may not be in the audience today, from the Mental Health and Money Policy Institute. And they, along with people like Mind and Rethink, have done some great reports to set out lots of specific things we could do to make the benefit system better for people with mental health problems, things which I would wholeheartedly agree with. There are other suggestions, though, that involve doing something sort of more fundamentally differently. One of the approaches I hear a bit about, I know that there is appetite, not necessarily from everybody in DWP or from policymakers, but certainly some of the people in DWP and other, people who think a lot about these issues think we should get rid of things like the work capability assessment completely. We should have a flat rate out of work benefit or a basic income and combine this with an extra cost benefit, so PIP, and get rid of the WCA. The advantages of this is that people no longer have to demonstrate their incapacity as part of an assessment, so the incentives are better, and the WCA is in some ways a bit traumatizing, so it avoids that in some respects. Nevertheless, I do think on balance it's a terrible idea. Happy to go into this more in the discussion, because it takes away the reason that we give money to some people with mental health problems, which is not just that they have extra costs, but they're likely to be out of work for long periods of time. And benefits are often not sufficient for people to claim for long periods of time. And there's also a massive political risk that this would just lead to a cut, basically. So PIP wouldn't end up being any higher, but a lot of people would see less income and have an even more precarious existence than they otherwise would. A third option, probably the one that I'm more keen on, but you can come back to me on it, is a system that takes disability equality more seriously. So there's a paradox that countries that have more disability benefit claimants have higher employment levels for disabled people, which is the opposite of what the conventional wisdom might say. This might be because these are systems that take people's barriers more seriously. They're not driven by medicalisation and compliance, but they're actually trying to have some sort of sense of equality. It might just be because there's better claimant experiences, leading to more willingness to take risks because people think they'll be treated fairly. Or a fourth and final option, this is going to be my last slide, I promise, is around the way in which we could have more inclusive workplaces, and whether, for example, the Nordic countries do a better job in creating places in which people with mental health problems and other disabilities can work without needing benefits. I'm not going to talk about my PhD thesis, but happy to come back to it, which is around the role of deteriorating job control in the UK. And we might think today about the role of work stress and the Great Resignation. But I want to finish with the words of a soon-to-be colleague of mine in the Central Department, Annie Irvin, who over a decade ago, talking about issues of fitness for work, said, perhaps the key question should not be whether an individual is fit for work, but whether the work is fit for the individual. Again, much as I have said a lot there, there's enormous amounts I've had. So I really hope this is the start of a longer and deeper conversation. I'm really interested to hear what you think about ways in which I didn't quite capture things correctly, or things I missed out, or just things that should be priorities. And thank you very much for listening.
Thank you very much, Ben. This has been a whistle-stop tour, just amazing, hugely important, what you're doing, hugely timely. And I hope that there are plenty of questions in the audience for you to expand or explore some of what you have been telling us just now. So I'm going to monitor the chat where people are can please include questions, but also feel free to raise your hand so that we can unmute you and you can just ask your question as such. So probably folks might need a couple of minutes to get their questions ready, but yes, use the chat. I will monitor it. I'm happy to read out your question. And if you like, pose it directly to Ben. So I'm not seeing raised hands yet. And
you know, it's what comes from doing a presentation where you cover a lot of different things a little bit, rather than doing a very provocative audience.
Yeah, don't worry, folks may be a bit shell-shocked, but here we have. So here is Sam saying, thank you, Ben, so interesting. If you or anyone has literature, best practice to share around mental health, food insecurity, and good interventions, I'd be delighted to see. And
yeah, so
that is a good sort of prompt to think about these sort of intersections.
Yeah, I don't know if Tom Pollard was able to come in the end, but he wrote an excellent report on mental health and food bank use earlier this year, late last year, which would be a great place to look at. I mean, I think much as I'm one of the reports from the Welfare at a Social Distance project this year will be on mental health and benefit system, but another one will be on food insecurity, following up one from last year. And there are some specific things about food insecurity that are helpful to think about, including food bank use and other interventions in the food system. But a lot of the times it's actually just capturing kind of deep poverty and the fact that really the benefit system is not giving people enough income per se. So while I think I've definitely directed to Tom's work and some other things in food insecurity, I think kind of wider issues around the adequacy of benefits are really important there, but happy to pick that up offline as well. I can see that Nick and Tom have their hands up.
Yeah, I thought I would sort of alternate between people raising their hands and people asking questions in the chat. So yes, Nick.
Hi. Hello, Ben. Nice to meet you from my old department from many years ago. On the knowledge gap question, one of the things that I wanted to raise was the possibility of doing a long-term qualitative cohort study, which there seems to be a gap between large-scale surveys where you just ask people things and narrative accounts and qualitative work, which may look at people over time, but is, as it were, inconsistent, as you said, in various ways. And one of the things I would like to be exploring with you is whether for the centre we could set up a large qualitative long-term cohort study to look at some of the issues that you talk about. One of the reasons for that is that I spent many years looking at the experience of families and individuals as a result of the collapse of the Soviet Union in East Central Europe and Russia. We eventually built over 12 years a cohort of families and the effects on them. It takes a lot of detail and time to unravel the effects of these things. And I just wondered what you thought of that.
It sounds like an amazing study, and it would be great to talk more about doing that. I think that would be really valuable, but I think what would make it most helpful is to try and find some ways of, you know, being with people in their interviews with work coaches or within their assessments, to have some idea of what is going on in those interactions. I think not so much that people don't want to tell you the truth about what's going on, but people, from having spoken to people just after and just before assessments and sort of piloted some of this stuff before, it's just a very emotionally intense experience, and people are not trying to record the details of an interaction in a way to see where it went wrong. They're just feeling really anxious about it often, and it's a kind of stressful experience, and they can reconstruct, I guess, their feelings and some of the things that happened. But to really get the value of following people over time and seeing how their lives change and how the system responds to that, I think it would be great to find some way, some methodological innovation where we can be trying to figure out what was actually going on with their interactions with the system, whether that's trying to look at all of their correspondence or their online journal, or to accompany them to meetings and assessments like that. But it sounds like a great idea, and I'd love to try and set something like that.
Thank you, Ben. I'm moving into the chat to Annie Irvine. She says the Centre for Society and Mental Health has partnership working at the core of its values. Fantastic partnerships exist with community groups. What are your thoughts on how we could also develop effective research partnerships with DWP, JCP to advance these crucial research gaps?
Yeah, it's a great question. Annie has lots of experience of working with DWP in the past. I have good links with DWP, and I try to talk to various, DWP is a lot of different teams. So I have good links with the UC team, I have good links with the disability assessments team, and so on. But I think the fundamental problem is that there is not, from a ministerial level, there is not a culture of transparency and openness that would let people come in and observe what is going on within the system. We see this also in terms of access to administrative data, where there's been, massive delays. It's just impossible to get the administrative data to do the sort of research that people would need to do, with the exception of Sharon Steveling, who's in a different bit of King's doing an excellent project there. So it's not that I don't think there's lots to be gained from having great working relationships with DWP civil servants, but I do think that the tone of lack of openness is being set by politicians at the top, and I don't know what it is that we do to change that, but I feel like we need to try and do something with that, because we need to see what is going on the ground. Sometimes it would be less bad than we expect it to be. I don't necessarily think it's against the minister's interest to do it, but it's certainly not where any of the ministers that I've tried to persuade to do this would be.
Thank you. So I'm mindful of time, and we might not get to everyone's questions. Just setting expectations. And of course, there's the opportunity to also write Ben directly with the questions that we're going to save the chat, so that Ben can see the questions as well. Next on the list in person is Tom Pollard.
Hi Ben, can you hear me okay? I'm on the commute, so
Brilliant. Yeah, I know you were just coming back from doing an NHS shift, so I really appreciate you making the effort.
No, that's okay. It's been really interesting to listen, and congratulations on the role. It sounds pretty exciting. I'd love to have a chat. I was just wondering if you've thought much about the links between people's experience of the benefit system and people's experience of health services and social care, because I think my experience at DWP was that people have seen so much through the kind of lens of their benefit claim, and actually that's just a small part of the support people receive. And there's lots of interesting connections around both evidence, but also kind of what support is available to people. So I just wondered whether that's on your radar.
I think it's an absolutely brilliant question. I think it is something that we need to think seriously about how it is that we do research on it. So I think that the need for it is also particularly apparent around the position of PIP. So people are getting these benefits to help meet the extra costs of disability, but in other countries, often those services would be provided directly in things that would be sort of closer to social care or health services. So we have this thing that the government says, look how much money we spend on benefits. Actually, we're more generous than other countries. But actually, there's just an incomparability here in terms of which system things are happening in. So once we start trying to both understand how it works in people's lives, but also compare this across countries, this comes to Ava's excellent question about, which country would it be best to claim benefits in as someone with mental health problems? We just don't know. And I think we need to do that sort of study to say, right, where is that experience better or worse? But in doing that, we cannot just look at the benefit system, because so many things will be differently allocated between systems. And we actually want to know if people's experience having mental health problems dealing with the state is positive or negative rather than specific bits. So I think it's a massive challenge to do research on, but I think it's one that we need to think about how to take it seriously.
Thank you, Ben. We can have one more question. So I'm taking it from the chat, and the answer would have to be brief, and the question is challenging and broad. So let's see how that goes. So Ava asks, very interesting, Ben, thank you. Based on everything you discussed today, what welfare system should the UK adopt? Which country is leading the way despite some of its limitations?
So I might just, I sort of partly responded to that in the last question, but Ava, I'm going to come back to you to talking about that. I'll come back to everyone in a second. Just to respond to Adam Kitz's really quickly about how you assess someone's mental health. I think we need to think about how we do this in the best possible way, and we need more evidence on it. But I also think we need to fundamentally question the idea that, say, work capacity is like an objectively existing thing that we can observe and assess within 15 minutes in an interview. I know that Annie has been starting to do some thinking on this. I think these are things that are sort of constructed in context and are not just sort of waiting for us to discover in that way. And I think we need to try and find a way of delivering services in the state that don't depend on this sort of mystical, perfect, objective assessment of mental health, but instead try and work with uncertainty and with things that emerge over time, and to accept that is the reality of mental health, which is not necessarily easy because it's a fundamental rebuilding, but I think it's really important. I know that Hannah is going to finish in a second. So just before doing that, to say, sorry we didn't get to everyone's questions, but genuinely, I would love to have conversations with all of you about different things that people are saying. So please do drop me an email, currently at my Kent address, because my King's one isn't set up yet, but do just get in touch, and it would be great to be part of the general conversation about where we go next in terms of research on mental health and welfare and work.
Wonderful. Thank you so very much, Ben. And thank you everyone for your questions in the chat. We're going to save it, but also get in touch with Ben. And I hope maybe there will be also some sort of links built between members in the audience who might be sharing similar interests, as you were already pointing to them, Ben. So really fantastic. Thank you very much. So I just wanted to quickly promote a couple of events in the centre in June. So we have a fantastic festival that celebrates partnership in society and mental health. And Verity is kindly putting the links into the chat. So feel free to sign up to them, to different events. They take place from the 18th of June until the 23rd. So please come join us for our festival. There's also going to be a researcher-led workshop on exploring trans youth mental health. So please explore the event pages, join us for other events, and sign up to our mailing list, etc., so that we can keep the conversation going. So again, thank you very much, Ben. It has been such a pleasure to hear about your work. There's a lot of thank you happening in the chat. So I hope this was a good sort of first introduction to what we do in the centre, and please everyone else stay in touch and have a good rest of the afternoon. So thank you very much.
Thanks, Hannah and everyone.
Bye.